If you're one of the more than 500,000 Americans who will have a joint replacement surgery this year, then this next segment is of critical importance to you. The most important thing you're going to do to make sure your surgery goes well is select a surgeon. A recent study of 2,247 people in the Michigan Joint Replacement Registry looked at the effect of a robotic assistant on three important outcomes. They looked at whether the dislocation rate was higher with a robotic assistant. They looked at patient outcome, were people satisfied with the procedure, and then looked at how accurately the implant was placed according to x-rays done after the procedure. Now, along with infection and nerve damage and blood clots, dislocation is one of the most extreme and feared complications of hip replacement surgery. Fortunately, it's rare. In most studies, hip replacement results in about a 2.8% risk of dislocation, and that's exactly what was seen in the current study of the Michigan residents if they did not use a robotic assistant. Now, interestingly, with a robotic assistant, the risk of dislocation was significantly lower. It was only 0.6%. Now, the risk is low to begin with, unless it happens to you. Dislocation can result in the need for additional surgery, permanent pain, and even the necessity of hardware which restricts your range of motion. So it's not something you ever want to experience. The patient-reported outcomes in people who had a robotic assistant were about the same, but both were very, very good. And as we know, total hip replacement is one of the most highly perceived surgeries of all the human body. The truth is never found in a single study. We look at multiple studies to try to find out what direction the field is heading and what we should do to make sure we get the best care. This finding, that a robotic assistant reduces the risk of dislocation, was also reported in studies of the Medicare database in the United States, as well as the Australian Total Hip Replacement Registry, the largest registry in the world. So the entire field really seems to be telling us that a robotic assistant is a crucial part of the skill set that your joint replacement surgeon should have. Now, on a personal note, in my own family, as a result of a mutation, my mother, my older sister, and my younger brother all have total hip replacements. In fact, they all have total hip replacements on both sides. Not one of my family got the benefit of a robotic assistant because they were done before the technology existed. But if my family members were having surgery today, you can darn well bet I would insist they find a surgeon who uses a robotic assistant. The data from this study and similar studies is simply too strong to go without it.